President Dr. Irfan Ali, flanked by Prime Minister Brigadier Retired Mark Phillips, Vice President Dr. Barjack Dio, Cabinet Ministers, health officials, and members of the public commissioned the state-of-the-art Diamond Regional Hospital on Sunday evening. The hospital, built to meet Chinese, British, and American medical standards, offers round-the-clock emergency care, surgeries, maternity and neonatal services, and outpatient clinics. With 75 inpatient beds, 3 operating theaters, and an advanced diagnostic tool like CT scanners, digital X-ray, and ultrasound, it promises to raise the bar for public health delivery in the country.
But whilst we want to encourage the private investment and expand private care to the best the world has to offer, we want to ensure that the government invests simultaneously in equivalent care so every Guyanese can have a minimum standard of care, regardless of which region you're from. And that is what the government is about.
President Ali stressed that the services offered will not depend on one's income or social standing. The Diamond facility was built in collaboration with China's Sinopharm International and is part of a broader $37.2 billion national health infrastructure project, which includes new hospitals in Lima, Dikindrin, Enmore, Bath, and Skeldon. The government's goal is not only to improve access but also to standardize care across all regions. From matching equipment to consistent medical protocols, the aim is to provide seamless and sustainable healthcare nationwide.
To ensure that we put systems in place so that the investments we are making will deliver high-class service, efficient and reliable service consistently. And I charge the more than 1,000 workers that will eventually work here in this hospital to understand that you are part of something much larger than yourself. And we rest this facility in your care. The patients who will use the facility, you too have a responsibility to ensure that the facility is not only kept well, but that generations to come will get the same benefit you got from this facility.
Complementing these upgrades is a massive investment in training, with over 6,000 nurses expected to be trained in the next 5 years. New nursing schools have already opened in regions 2, 6, and 10. Health Minister Dr. Frank Anthony said the former Diamond Hospital, in operation for 18 years, could no longer meet demand.
Think back, not so long ago, we didn't have much CT in the public sector. And under the last government, they had some old CT scans, a 2-slice. One went to Bartica, one went to New Amsterdam, and they were so old that even when we were looking for parts to fix them, we couldn't find the parts because it's out of production. Now you will have a modern CT scan that would be at this hospital, and you can access it all for free.
The launch was also attended by Chinese Ambassador Yang Yang, Sinopharm Vice President Yang Hailu, and Health Ministry Permanent Secretary Malcolm Watkins. Beyond the coast, hospitals are also being built in Moorooka, Camarang, Kato, and Lethem, alongside a pediatric and maternal hospital at Ogle and a modern facility in New Amsterdam. Major upgrades are underway at existing hospitals in Bartica, Linden, and West Demerara. President Ali reminded attendees that these projects were promised in the PPPC's 2020 to 2025 manifesto, which outlined a plan for a world-class inclusive health system. Despite delays caused by COVID-19, the government has already upgraded more than 400 health facilities, including 26 health centers. With investments also being made in electronic health records, AI diagnostics, and robotic surgery, Guyana is on track to become a regional health hub. For the newsroom, Kurt Campbell.